Trénaunay syndrome is it's a type of combined malformation, including venous and lymphatic malformation. Here seen in the picture, there is lateral vein or vena marginalis of cervical. Another picture for cervical vein, which is a congenital vein. This low flow malformation consisted of triad of capillary, venous, and soft tissue. Capillary malformation, venous malformation, and soft tissue inverted. And there is no shunting, no shunting. Pathophysiology. Commonly, this is a genetic, including PIK3CA pathway. In the dynamics, there will be venous hypertension, valvular incompetence, and the resistant embryonic pain. Clinical, you will find the port wine stain in the lateral distribution of the lower limb, and also there is a port wine stain in the trigeminal nerve distribution in Sturge-Weber syndrome. The type, it is presented since birth, so it is AV malformation. Venous system, you will find early onset varicosities, deep system anomalies, for example, hypoplasia or aplasia of the deep system. You will find the lymph overgrowth, lower limb mainly affected. The complication, you can find also a CBI, recurrent thrombosis, bleeding. Systemic complication, you may find what's called localized intravascular coagulation, which can be converted to DIC. One of the complications of Klippel Trénaunay, you may find GIT bleeding as either lower upper GIT bleeding. And the lymphatic component of Trénaunay may cause edema and infection and lymph dissection. First line imaging duplex, it will show valvular incompetence and the status of the deep veins may be absent or hyperplastic. Gold standard is the MRI. It will define the extent of malformation and the relation to adjacent structure. Avoid angiography has no role in angiography done in high flow lesions like Parkes-Weber syndrome. CT venography here may be done in selected cases. Treatment is immediate vascular, interventional radiology, and dermatology for the bacterial stain. Conservative treatment is a cornerstone by compression treatment on this varicose vein. Medical treatment. In rare cases, we may give anticoagulation or prophylaxis against LVT. Sirolimus rarely indicated in extensive symptomatic patients. Sclerotherapy is the mainstay of the venous malformation. Concentrate here, sclerotherapy is the mainstay for venous malformation, and you can do EVLA in some selected cases. And before the EVLA ensures that the deep system is treated. Surgical for ligation and stripping of the marginal vein indicated if this patient has symptomatic localized malformation. Ensure that the deep system is patent for in superficial vein ablation. Resistant embryonic vein, it can cause a major reflux source. This is rapid differentiation between Parkes-Weber and Klippel Trénaunay. Parkes-Weber is high flow. There is shunting in Parkes-Weber. There is sterile in Parkes-Weber. And there is a possible high cardiac output heart failure in Parkes-Weber. Genetics is different. PI against GCA and Klippel Trénaunay, RASA in Parkes-Weber.